Mario, I forgot to say that yesterday. Yeah. We love Toronto people because they deal with all the issues, and then we just say, well, everything they said, we face the same thing. So when we had our meeting in our region, which is London and Chatham and Leamington and Windsor, we tried to not to get in-depth discussion about things that we knew Toronto is going to deal with, but some of the issues that we are facing in our region. And basically we look at two areas, and I'll talk about the two. One is the healthcare needs of newcomers and immigrants and refugees, and especially medical and psychological support that there is nothing in our region that we can provide them or help them with. And some of the community issues, for example, London has a forum that they are organizing early November to bring all the healthcare services together and do a mapping of the services and see how they can provide support services to newcomers. But that's a huge issue for us. And areas that we would like to see, particularly we will be looking at healthcare needs of seniors and youth and the whole family. And also the whole issue around the waiting 3 months. I know Cali had a campaign and we are encouraging everyone to support that, to eliminate this 3 months phase for newcomers, and they have to wait for the OA part before they can access healthcare services. So healthcare services is an issue for us. The other thing we discussed was how Windsor was put on the map for the past few months with the whole issue of the Mexican and Haitian refugees, and I just want to shed a little bit light on actually what has happened, because media end up blew out of proportion, and this was a good story for them. The local politician also had something to do with it. Maybe I'm not going to get there. Yeah, Mary wanted me to choke our mayor. I wouldn't do that. But there were some politics played, but there are some realities too. In a short period of time, you see relatively a large number of refugees coming from the Mexican refugees coming from the United States, and we wish we would have dealt with it a little bit differently. But it was a influx of refugees coming, and our main issue was that not only the community response wasn't the way that we would have liked to see, but we felt that some of the local politicians kind of dragged their feet and used the story to score some political, situation that they had to deal with. But it also brings into the light a couple of real things. One is the whole eligibility issue for the services. And every time there is a situation, then you see that becomes a huge problem for us, for agencies to see if they can provide services, they cannot provide services. The other thing is the human cost. I mean, there are real victims in this situation, and I think no one heard their stories. And as an agency, when we were dealing with them, if we felt that they were misinformed, they were taken for really right, they were charging some of the money from this immigration consultant, and we feel that they should be at least on a federal level. And we know that the government is doing some work, but has to be more information putting out, and kind of trying to provide real information out there, so situation like what has happened in Windsor doesn't happen. We are not seeing a huge influx as they were telling us. The buses are coming, things are subsiding for now, but if anything comes up, we'll let you know. That's it.
Thank you. Any question for the Western region?
Well, we have some regulations in Canada.
Let me.
Not governing United States, and those are information that the immigration consultant in the United States providing false information, such as there are special programs for Mexicans coming to Canada, or information that we're not true. So we don't have jurisdiction over it.
We have the Council of Immigration Consultants here, and one of the conversations we've been having with Citizenship and Immigration National Headquarters, but as well with the society, is that they need to be doing more promotion about the society abroad. Because one of the things that people are not finding out is that if, as an immigration consultant, you're not registered with the society, immigration won't even look at your file. And I have been speaking with Rivka Augenfeld, who is one of our Montreal colleagues and is a chair of the society in terms of finding money to do that kind of promotion outside of Canada.
Any more questions for Debbie?
Thank you, Reza. They're here.
Yeah. So what we are hearing, they are kind of rippling out. I was talking to Lori, and some of them are coming to Toronto. So some of the agencies in Toronto are saying, yeah, this is a personal opinion. I pretty much doubt that they would stay in Windsor. They would probably move to cities like Toronto or even in England because they have a large Mexican community there. So they would take jobs.
And I guess related, health also came up in several of the regions, and the local health education networks, the LIDs, are both a curse and an opportunity. That, you know, Cassie, I think, probably already open.
Yes.
Thank you very much.